It was an old expression, statistics don't lie, but statisticians do. Think about this. You walk into a company and you want to see how wonderful this might be, and they say, 3 days, who do I care? But think about it. That's comparing responders to non-responders. And if a person does not respond to the drug, they will not take it. And look at that organization that says whether a drug is worthy or not worthy. They compare the clinical trials and they say, what is the difference between active drug and placebo? Assuming this is just like somebody who took a drug to prevent a heart attack and was on it for 10 years. The fundamental difference is if it doesn't work, you stop it. And they don't have the sense, the ability, the knowledge, or the brains to figure that out. So when you talk about a 3-day reduction, you're talking about across all patients. But if you look at the 50% responders who will stay in the trial, it's much higher. And the question I'm raising is, using those 3% or 3 days, I think destroys the benefit of the drugs.
That's true.
And I think we should talk about, in those who respond, how well do they respond, not the average of people.
No, I agree with you that responder rates are a far better way of addressing, for an individual patient, how they can think about a medication, not looking at a population, but what they can individually.
We should look at the population of responders versus non-responders.
True. But in this open label study that we were talking about, it is somewhat biased because patients who drop out because they're not responders or because they may have had side effects, those are not included in this long-term analysis.
But that's the point I'm making. That is exactly the point I'm making.
You, Steve.
That if you don't respond, you won't stay on the drug. So from a cost-benefit analysis, all the assumptions are wrong. You don't stay on a drug that doesn't work. Unlike a drug for hypertension or diabetes or long-term benefits, you do. That's the fundamental difference, and they have to be analyzed differently.
It would be interesting to see, take this cohort who have been in the open label extensions and analyze their month 1 to 3 or 1 to 6 data and see how much different it is from the entire cohort.
But Steve, I would add you can have it both ways, actually, because in the open label trial where you enrich it in a sense by only looking at responders, you look at the percentage of patients that dropped out due to either adverse events or lack of efficacy, which you had previously looked at, and it's 4, 5, or 6% for each of those for a lack of efficacy or side effects, whereas for the topiramate trial by 12 weeks, 44% had dropped out. At the same time, we now have a very remarkable study that was also presented at the AAN, which was a randomized controlled, placebo-controlled trial of eptinezumab for chronic migraine for a year. And you can look at a year and compare to placebo at a year. And in that study, again, unprecedented responder rates in which 54% of patients had at least a 75% reduction of their mean monthly migraine days at a year. And that was not a biased study. That was a placebo-controlled trial. So you have it both ways. You can do the analysis both ways.
I'd like to make our audience aware that the Topamax used in that trial was an immediate release topiramate, not the extended release that you talked about. So that tells us nothing about how changing the formulation will lead to better tolerance and better use of the drug. So we have to be very careful in this day and age of not only looking about the difference in drugs, the delivery system, the formulation, in terms of trials. And that was immediate release generic topiramate. I just wanted to point that out to our audience.
Just to piggyback on what you were saying with this study, 1 year with eptinezumab, it's in a sense we're trying to train the brain, teach it not to have migraine attacks so often. And sometimes I use this analogy with my patients, and that helps them to understand why it may take time and why it may be slower than we want. Some dogs you can train very quickly to do tricks. Some people learn languages very easily. I do not. It takes me a lot longer to learn a language than somebody who's very facile with them. So some people can learn a language in 6 months, some it takes a year. But if you keep studying it, you get better and better, you get more and more fluent. So the longer you stick with it, the longer you keep training, the better you're going to do.